Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer, a dental hygienist from Bulgaria, Buffalo, New York, Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers, 8 Lumineers, 10 Lumineers, 6 Lumineers, 10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient. And now we're not treating teeth anymore. We're treating smiles. Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. I'm going to have to work hard today. I understand I'm going to place 10 Lumineers today on this patient. And we're going to do it in about the same amount of time that we would do 6 or 8. It'll take a little bit longer. First thing I did is I got a dental assistant who knows what I do. She's been helping me for like 25, 30 years, something like that. The other thing you want to do is have everything set up ahead of time. So maybe we could just show the audience what Lisa's done prior to getting ready for this patient sitting in the chair. But anyhow, what Lisa's done is put 2 solutions on the porcelain. And she's put porcelain conditioner on, which is an organic acid, very important. And what it does is it activates the serenade prime. The serenade prime is inactivated silane. That means it's got an extremely long shelf life. Whenever you get magnification, you want to have 4 power or more, okay? And I look for a focal length about this far, but with 4 power magnification, this is what I'm seeing. So you'll see me working on the patient. When you start curing through porcelain, you need the power of the sapphire. You can cure all of your composite resins in about 3 seconds. The next thing that's very important is you need to have a good impression. We recommend the Lumineers impression materials. It's a double wash system, and it gives really sharp margins. I suggest that when you take your final impression, you ask your patient to wait in the reception room while you pour the model and make sure it's satisfactory, and then let the patient go home, because sometimes you can't catch a little area of defect until you pour the model. So she doesn't like the color, and she has that gray margin on there, and we're going to bond to that just like we're going to bond to the natural teeth, but we'll do a little different surface treatment. Turn your head toward me just a bit. You know, I'm not showing that much gray margin here, but normally what I would do is cut a little trough in there. But I think I'm going to be able to mask it without having to cut the trough, because there isn't enough gray showing in there. That's mostly the shadow of the gingiva. But what I would normally do on a patient that had a metal margin showing, I would just cut away the metal, not touch the tooth, and go right behind the porcelain where you can't see it. So we'll pretend I just did that. This is a bicuspid pontic. You see this right here? Now what we want to do is get just behind that porcelain so the metal doesn't show. Over here we can't get behind it because that's space between the pontic and the porcelain crown. And we're going to put a Lumineer on the pontic, and we're going to put a Lumineer on the crown. So here we're going to take away just a little bit of that. So we're going to do 3 porcelain surfaces today. And this is what we're going to do now, is just do that surface preparation. The next step is we're going to micro etch these surfaces. So close your eyes, don't breathe. Close your eyes, don't breathe. So we're micro etching the porcelain. She has nice gingival tissue. Now we're going to put on paint on dental dam. We're going to put that on the lingual side before we do surface treatment. So what we want to do is we want to put the paint on dental dam on before you do surface treatment. And where you have diastemas or open embrasures, you want to be careful that it doesn't go all the way forward because you don't want it to go to the labial surface and prevent setting and polymerization. And I'll give you an example of that right here. See this space right in here? You want to make sure when you're putting the paint on dental dam in that it doesn't come from the lingual all the way through and prevent seating of your porcelain veneer. And wherever I put the paint on dental dam, nothing will stick to the surface because the paint on dental dam will be there first. Close your eyes. And we polymerize this for about 3 seconds at about a ½ inch away from the surface. See that blue in that interproximal? Yeah, that's probably about as far as you want it to come through. If it comes through more and you try to put your veneer on it, then it won't seat. And everybody gets a look at this now. Open wide. Now we're going to take Porcelac. So this is buffered and it's a low viscosity brush. And we'll put that on for a few minutes just like we etch enamel. Maybe a little less than a few minutes. We're putting it on the punnic. And put a little bit on here. And now we'll wash it off. See if you can get that suction over there. Now the next thing we're going to put on there is porcelain conditioner. That's citric acid. So I use Etch and Seal because it's phosphoric acid and it has aluminum oxalate in it. So if you're working with a patient on regular operative dentistry and you want to etch the enamel and the dentin at the same time, you can do that. And the aluminum oxalate will go a long way towards sealing the dentinal tubules and preventing sensitivity. So now I just push this around. I like the medium viscosity because see I can control it. It doesn't run all over the mouth. If you use a liquid, it runs all over. We've put citric acid on the porcelain surfaces and we put phosphoric acid on the enamel surfaces in our surface preparation. I'm going to take Serenade Prime and put it, that's the silane, put it on these porcelain surfaces. Now we're putting tenure AB on the enamel surfaces. So now we're going to show you something about Tri-N. We're going to use the Ultra Bond Tri-N paste. The Tri-N paste, when we put it on, will give a much different look to veneer, a luminaire that doesn't have any Tri-N paste in it because it closes all the spaces, it fills it in. Remember, your restoration is not the porcelain. Your restoration is the Ultra Bond. It's a restorative. That's where you're going to get your stress-resistant, non-micro-leaking margin. So the tooth on the left, the luminaire on the left, has no Tri-N paste. And, well, they match pretty close in this case. But there is a little difference, and the reason is because when light goes through a medium, it continues on until it exceeds the index of refraction. So when you go from porcelain to air to tooth, the air exceeds the index of refraction, so what reflects back is the etched surface of the luminaire. Whereas when you put the try-in paste in, it goes through continuously to the surface of the tooth, and what you get back is the reflection of what you're going to get when you put the Ultrabond on. They're the same shades and everything, except one is actively designed not to set, and the other one, the Ultrabond, is designed to set. So now we put the white on here, and we'll give the patient an opportunity to select the shade. And give her the mirror. We want to take the mirror off on the side. And do you like the color of the tooth on the left or the color of the tooth on the right? You like that one? Okay. She doesn't want Hollywood white. Okay. Now what we're going to do is take Tenure S. Now two things happen with the Tenure S. You clean off the try-in paste, and you also win the race with resin. Because remember, until you get resin on that surface, a race begins between contamination and resin. Whoever gets there first wins the race. Now what I'm going to do is put a little bit of flowable in that gingival margin on that bicuspid. I'm using Virtuoso Flowable. But I think I'm going to put a little Tetra Pak in there. There it goes. If that looks pink to you, I'd be surprised too, but we call it pink and everybody remembers pink, so I guess it's as good as A3 for a name. Now we're going for left central. Okay. Make sure we get that all the way down. You don't want to use too much force. You should just right central. Okay. Right lateral. Okay. Left what? Cuspid? Right cuspid. Let's stop here. And what we'll do is put the left lateral on. And then we're going to take the 2mm tip and we're going to spot cure it for 1 second. Close your eyes. We'll cure the center of the tooth, but not the periphery. Close your eyes. Close your eyes. Now that will fix it in place. There we go. Close your eyes. Close your eyes. Close your eyes. Now we're going to come over to this porcelain surface. And remember, the Lumineer doesn't know it's bonding to porcelain, so it's got a heads up already. Close your eyes. Close your eyes. Close your eyes. Close your eyes. Okay. And I like to go by our back and wipe off some of the excess with Tenure S on the roll. And that just helps a little bit in the cleanup. Okay, now we're going to take and polymerize 10 Lumineers in 1 minute. Close your eyes. Close your eyes. And close your eyes. And close your eyes. And I'll just see if there's anything not polymerized around here, and it's all seems to be set, so I can go back and get it because she has a rather large tooth. And we'll take this off on the lingual side. And so we'll just go in and remove this blue paint on dental dam. So now I take the football-shaped diamond, I go around the lingual side, And I'm blending the Ultrabond and the porcelain and the enamel all together so that it's now one solid homogeneous mass. You need some water on there. Always do it with water, because if you let your porcelain get overheated, it'll cause fracturing. Yeah, I'm knocking off the Ultrabond that's kind of floated around there. Now I'm using a long, narrow diamond, and I'm going up the inner proximals of these, and I'm removing the Ultrabond. It's very important before you open the contacts to remove as much of the Ultrabond as you can. And when you're bonding porcelain to enamel, you can open the contacts on the placement visit. It takes about 24 hours for a silanated bond to reach its maximum bond strength. And when I have opened contacts when I'm bonding porcelain to porcelain, sometimes I've had it fail, pop off. So I always do all the trimming and make sure that I don't have any traumatic occlusion. And then I wait 24 hours or a week to open that contact, and I've never had one pop off since. And I use a 12-fluted burr because it removes the Ultrabond, but it doesn't do anything to the porcelain. The Ultrabond is softer than the porcelain. Okay, so I'm just going around with 4-power magnification, and I'm opening up these embrasures. Now, if you recall in this area, remember I showed you not to let the dental dam go through this area? You have to decide if you really want to open that area up and have that show through. See how this is coming to life now? I still have a porcelain ledge on the gingiva, and I'm going to show you how to get rid of that porcelain ledge. Okay, so now we come back and we take the Shure 349. This is an orthodontic instrument. You want to be sure you use this and not a hygienic scaling instrument, or you'll scratch the porcelain surface. And so we just like you're scaling, you take this off, and you want to be sure and tell your hygienist not to use their scaling instrument on the labial surface of any porcelain veneer. And we never get it all off on the placement visit. My objective is to create a dramatic change in appearance. So let's take a look at the occlusion. The occlusion now is extremely critical. If you have fractures after placement, close. Gently grind your teeth around. Take a look at how nice those look, even before we really got any into finishing. Open. And all the marks seem to be coming out on the natural teeth. That's a break many times. What you don't want to see is marks on the edges of the porcelain. That'll knock it off. See that cuspid right there? My finger's pointing to that spot right there. That likes to knock off the distal of laterals. So I'm going to go in right now and reduce that a little bit. So now we're going to take the needle nose diamond, and we're going to open up the embrasures and get rid of the shoulders. Now the thing we're not going to do today is open the contacts wherever we put porcelain on a veneer on a porcelain surface, because that takes time. And you just go around here, and this is where your 4-power really pays off, because I'm getting rid of that shoulder. It's a supragingival shoulder. And I can open up these. So what we'll do is open some of the contacts today, and we're going to use a thing called a seri saw. Then what you do is you rock it, you don't saw it. And if they're difficult to open, what does that mean? It means you didn't get all the ultrabond out. Now, I'm not going to open this contact between the distal of the cuspid and the bicuspid because what? On that one, I've got porcelain on porcelain, and I don't want to put any stress. So we won't go to the lateral either. We can go to the distal of the cuspid. But if you're sawing and they don't go through, then stop sawing and start wiggling, rocking it, and that'll work. Now we're going to take the safe-sided diamond disc, and we follow through because after you've opened it with the saw, you still have excess on there. So then you just file it down. And any contacts that you don't open today, a lot of them open themselves. And what we didn't finish today, we finish on the next visit. That's where you make the final touch. So let's take a look at the lingual side. See how that's all cleaned up now? Smile, big smile. What do you think? You want to take these home?
Oh, they're gorgeous.
They're gorgeous. Okay. So if you're ever in the area or you want to come out here, just wish you all the luck in the world, giving everybody the smiles they like to have in the way they like to get it. The old paradigm is gone. The new order is in, and you're going to have it. Okay.
I've had a crown in the front for over, well, it's the third crown in 35 years I've had it, and it just seems to be making my smile less brighter. I'm not comfortable with it. It's not matching my other teeth as well. To be honest with you, no, I did not look into it because I have felt all dental, anything that had to do with cosmetic would be invasive, and I didn't want invasive dentistry. It was totally different than what I thought. I really thought there was going to be a lot more prep, and it was going to take a lot longer, and I was totally surprised by the result.